Whether it's for you or a family member, diabetes diagnosis can be a scary one. Proper care and management are key to preventing complications, and Dr. Scott Isaacs from the American Diabetic Association gives you the keys to managing diabetes.
Diabetes is a very serious disease, and I think the problem is that many people don't have any symptoms when they're first diagnosed. But the main complications of diabetes are problems with the heart, cardiovascular disease, strokes, but also complications like blindness, amputations, kidney failure, and they take years to develop. And so many people in the early stages, they may be in denial, they may not think it's a real serious disease, but with time, the effects of blood sugar on the body over many, many years can really cause quite a lot of damage. A lot can be done to prevent diabetes complications. Lower blood sugar definitely prevents the complications of diabetes, such as eye problems, kidney problems, and amputations. All diabetes is not the same, and there are two general categories: type 1 diabetes, which is where the body doesn't make insulin, and type 2 diabetes, where the body is resistant to insulin, or the hormone insulin doesn't function well. Each person with diabetes requires an individualized plan, which includes nutrition, lifestyle, physical activity. For some folks, medications, pills are effective. For others, insulin is needed. And for some, a combination of both pills and insulin are required to control the blood sugars. One thing that a lot of people ask me is, does eating sugar cause diabetes, or does eating sugar affect my blood sugar? And sugar does, but it's important to know that it's not just sugar, but any type of food can affect your blood sugar. So whether it's sugar, carbohydrates, protein, or fat, if you eat it in excess, it can raise your blood sugar. Medications alone are not a great way to control diabetes, and really medications should always be used in combination with nutrition and physical activity. And I've seen many of my patients that when they don't follow their diet, when they don't exercise, the medicines simply don't work. And so medication should never be a substitute for diet and exercise. I think once someone's diagnosed with diabetes, it's important to keep that diagnosis so that we can do all the routine screening so we don't miss complications that still may occur.
If you're overweight or you have a family history of diabetes, that puts you at an increased risk of getting it. And it becomes especially important to make diabetes prevention a priority. Diabetes prevention is as basic as eating more healthfully, becoming more physically active, and losing a few extra pounds. You can log on to the American Diabetes Association's website at diabetes.org for more info.